And in our ECHO presentations that focus on youth with multi-systemic involvements in really multiple areas of need, we don't really consider kids that just have substance use needs. And very rarely is that the situation anyway, rarely to the point of really exclusion, that you would ever work with a youth that would just have substance use needs and not have needs in some other areas. So this is considering co-occurring needs and really multiply occurring needs. So the direction, what I hope to capture today, considerations about matching treatment design to youth with multiply occurring areas of need that include substance use. And really that's what I want to spend the most time on today. When I first considered how to put this together, I thought, well, I can present, there are these evidence-based programs, there are these promising programs, here's what's available in Ohio, here's what I wish was available in Ohio. And that's useful, but really the base that all of this is built upon really are the considerations around the treatment match in consideration of the treatment design itself. So I think that that's what we're going to spend most of the time on. Then we'll do a quick overview of some of the recognized evidence-based and some programs that are available in the States, and then links to resources for program listings and ratings and really how to consider treatment match and considering evidence-based programming. We're just going to touch on that part very, very quickly, but the slides will be available to you afterwards, and then hopefully they'll be useful in that way if you decide to come back and take a look at that. So building the base. What are the considerations in providing care to youth who have substance use needs that have been identified? Really starting out with that is just the identification itself and how easy it is to miss that identification a lot of times in working with youth who have a lot of different identified areas of need and overlooking, if it's not something that we are intentionally looking for, is identifying that substance use need in the beginning. It is important, and if you were with us, I don't know, 2 or 3 weeks ago, I did a real quick training on screening and assessment, and the importance of regular screening for youth regarding substance use needs, because they are things that are easy to miss, especially early on. If treatment has stalled and there's no rationale for that, it is a really good time to do screenings for substance use needs. We know that the earlier that substance use needs are identified, then there is a better chance of decreasing the impact of substance use. We also know that the earlier that substance use starts for somebody, and in this talking about a youth, the earlier it starts, just, the worse the predictions are. There are different measurements that consider early initiation of drug and alcohol use. Some studies do it at 17, which in a lot of our experience on this echo, I think it's that's a little bit later on. And some of them say, 11 or before. And I think that is those of us that work with youth with a lot of areas of need and pretty more substantial substance use needs recognize that it's not, sadly, it is not uncommon for youth with a lot of areas of need that have started substance use at 11 or before. And when it starts that early, then the expectation for the course of substance use disorders, the number of substances used, the number of co-occurring mental health needs, all of these things increase considerably, as does then the likelihood of both previous and future traumatic experiences, both from a developmental and an individual experience component. So the earlier that we can identify things and we can start to match some direct addressment of those needs, the better. Other considerations, treatment designs need to be tailored to the unique needs of the adolescent and family. And it's like the rocket science statement of the day, right? Treatment needs to be tailored to the individual needs. That's the way we always think about approaching treatment. And I'm gonna expand on that more in the next slide. External motivation, that is pressure from the outside, a lot of times is helpful working with substance use needs in youth. that external motivation, hopefully from parents, not always, but it can be from the school, from courts, that can be beneficial. In some externalizing needs, and certainly in substance use, which is a really strong mix of both externalized and internalized need, that external pressure, that external motivation can be a very key component to keeping a youth engaged and motivated towards treatment. Regular drug screenings are very helpful. I'm not going to expand on that right now, and some of the resources that I'm going to give you really talk about the importance of regular, or the utility, I should say, of regular drug screening for youth who have identified needs in that area. Have an expectation of co-occurring and comorbid needs. As soon as drug and alcohol needs are identified in a youth, and I've talked about this in a previous one, there's over a 70% chance that there are going to be co-occurring mental health needs. So if substance use needs are identified initially, the expectation, a very strong expectation, is that this isn't just a substance use treatment match. This is a co-occurring integrated treatment match that needs to be considered. And that is really one of the big components of considering treatment and matching treatment for youth with identified substance use needs. Treatment is more effective when all areas of need are addressed simultaneously. So it's not, one thing followed by the next, followed by the next. One thing isn't considered more important than another, treating the whole individual, treating all of the needs that are identified. And adolescent drug and alcohol use, AOD, alcohol or drug use, rarely looks like adult use. It is easy to really over-pathologize, to overdiagnose teenage, adolescent, youth drug and alcohol use, because it is very scary. They're more opportunistic users, they're more bingy users, and really just teenage drug use is scary, especially mixed in. A lot of times it's mixed with some increased impulsive behaviors, goes along with maybe some oppositional, some conducty kind of stuff, and it becomes very scary. But it doesn't present in ways that we have expectations, or maybe that we've learned to identify with adults. And so just like approaching everything in working with the population that we talk about here, viewing the needs, what's going on, and understanding the individual and the family system through the lens of appropriate adolescent development is very important. So part of the tailoring to individual needs, it is very helpful, and this is kind of that expanded approach, taking a social ecological approach that considers a youth's family, collateral, and environmental overlaps, these areas that overlap with the individual, with the youth, him or herself, has demonstrated, perhaps, that's in parentheses, it really has consistently presented the best hope for beneficial change, trajectory in a healthier direction. It's just, we kind of hedge and say perhaps because it's, there's not a ton of research for adolescent comprehensive integrated treatment approaches. There are ones that are kind of hyper-focused, and a lot of times with evidence-based practices, they have been investigated in a very narrow field, and then we try to expand that. But finding matches in ones that are more adaptable, and really ones that have a family inclusive component, have demonstrated great effectiveness. So part of the match considerations, part of this expanded multidimensional understanding, so that we can find the best treatment match and matches, and the components that we would like to include in serving youth and their families. Part of that multi-dimensional approach, when substance use is in the consideration, when it's in the mix, ASAM, if you're familiar with that, and if you're providing any level of addiction care in Ohio, you should be familiar with that because it is required. It's the American Society of Addiction Medicine. It outlines and describes a multi-dimensional assessment approach, and then that segues very nicely into a dimension-based risk and need assessment based across 6 dimensions. And then that informs level of care decisions and treatment match. And so whenever drug and alcohol use is identified as an area of concern, in an area of direction in a treatment plan, we do need to include ASAM considerations and an ASAM level of care determination. So a couple of additional considerations just in building this base before we quickly get into some of the programming. Approaches that address emotional and interpersonal dysregulation can be broadly effective. And by broadly effective, it's going to capture more than just drug and alcohol areas of need, but reactivity, emotional reactivity. And when thinking about adolescents from that developmental perspective, how often is emotional reactivity descriptive of really just about any kind of disorder that we can consider? And so the dysregulation skill building, the regulation skill building, both with the youth and with the family, has shown a lot of benefit across a really broad spectrum, including reduction of drug and alcohol use, problem solving, impulse control skill building, really in that same ballpark. Just one consideration about group therapy for adolescents. There's evidence for good efficacy of and the benefit of group therapy. There's a caveat there that group therapy with adolescents, period, not just in drug and alcohol use, but really specific to drug and alcohol use, benefits greatly from having a pretty strong and experienced facilitator, because it can have a reverse effect, and iatrogenic effect. And so there's your word for the day, iatrogenic effect, where the treatment itself actually exacerbates or creates the problem. And so in group therapy with adolescents runs that risk. Not saying that it's always going to happen, but it does run that risk. So that's just an area of consideration. So right at the time when I was tasked with putting this together, right at the same time, coincidentally, SAMHSA put out treatment considerations for youth and young adults with serious emotional disturbances, SMI, and co-occurring substance use. So I mean, it was perfect timing, and it's part of their evidence-based series. In this publication, they discuss challenges around care to youth and young adults who have co-occurring needs. They present 3 strong evidence-based options, and then they also present examples from successful programs from around the country. And I'm just going to touch base really quickly on what they present. They talk about cognitive behavioral therapy. I think most of us are very familiar with that. It does have a strong evidence-based. The one big, I don't want to say exception, the one big consideration in this is that CBT matches well with folks who are at a higher level of motivation towards change in things that are going on. And adolescents who come into treatment with identified substance use needs. And a lot of the things that co-occur with that aren't necessarily at that level of readiness. And so sometimes some motivational preparation before you get to that can be effective, but CBT really infuses with a lot of different approaches. They also talk about MDFT, multidimensional family therapy. That's manualized. It's well demonstrated for helping to reduce substance use, oppositional behaviors, and family conflict. The third thing that they present is pharmacotherapy. They do an overview of developmentally matched medications, both from the mental health side and from the substance use side. So that's a nice primer, I think, for a lot of us. Certainly for the physicians, they would need it to that level. But for those of us that maybe aren't as comfortable or cognizant of some of the areas, that we would think about in working with the families, it provides a nice overview for that. So, and also in the review of, they wrap up with examples of programs from around the country. They do a feature on Nationwide Children's Hospital, based in Columbus, in their Treatment for Healthy Alternatives program. So big congratulations to Nationwide in that, and their approach to providing co-occurring care to adolescents and their families. So now I'm going to move through these really quickly because I'm kind of at the end of my time, and I'm only about halfway through. But that was the big piece of what I wanted to talk about. I'm just going to mention these. I'm not even going to do the descriptions of these. They will be available in the slides. And then if you do want more descriptions on this, Kara will connect you with me, and I will talk your ear off on any of the ones that you would like to consider or think about. So motivational interviewing is always a great match and infused with everything in approaching working with adolescents and working with families and really the collateral systems. and it's a good starting point, and then you can infuse other areas, and it just blends well. So, and consideration of MET kind of approaches as well. Contingency management with a really good behavioral base. You know, you don't learn anything from punishment, you learn and you change from reinforcement, and contingency management is about that. MST, multi-systemic therapy. These are social ecological models on this page. MST is probably the most evidence-based approach that is out there when it comes to providing youth family oriented care for adolescents with really delinquency, oppositional, and drug and alcohol use behaviors. Integrated co-occurring treatment program, which was designed very specifically for intentionally integrating care. IHBT in Ohio is not directed necessarily at substance use by youth. However, the social ecological approach in IHBT captures a lot of the things that we're talking about. Some other family-focused models already mentioned: MDFT, FFT, BSFT, and IFAST programs. I know for sure that there's FFT and IFAST programs in Ohio. I don't know if there's BSFT or not. DBT, dialectical behavioral therapy, infuses very well with a lot of the programs that I work with that provide care to youth. You know, certainly we think about that with trauma-focused care. But it does a really good job, and it has shown efficacy in integrated co-occurring designs in reducing substance use. TF-CBT, which is the trauma adaptation to CBT. There's also MET-CBT, if you're familiar. That came out of the cannabis youth treatment series, and also coming out of the CYT series was the adolescent adaptation of the community reinforcement approach, which has shown really good results. Targets, which is Trauma Affect Regulation Guide for Education Therapy. This is coming from a trauma background and has demonstrated really good results in reducing drug and alcohol use, and so has Seeking Safety. And again, these are really inclusive and focused on trauma care. So now just some resources that you can look at to expand on those programs that I very briefly touched on. SAMHSA has a resource section, a resource guide with evidence-based practices. The link is there. Youth.gov has, I don't know if this is picking up where NREP got cut off or not, but a guide to evidence-based practices specific to youth, and it's very useful, and that's at youth.gov. Other resources, APA put out Disseminating Evidence-Based Practices for Children and Adolescents, which is a nice review in terms of considerations about EBPs and matched with youth. IHBT Ohio has a lot of linkages to the areas that we've talked about. It's 5 or 6 years old at this point, but NIDA put out Principles of Adolescent Substance Use Disorder Treatment, a research-based guide. The link is there. It goes through several individual-focused, family-focused, and skill-building evidence-based programs that match well when substance use needs are identified in youth. In a book that I turn to quite a bit is Youth Substance Abuse and Co-Occurring Disorders. It was edited by Dr. Kaminer. It has several chapters that build up to some understanding of co-occurring needs in youth and some of the developmental aspects of it. And then each chapter after that tackles a specific area of ADHD, of conduct disorder, of anxiety disorders, and approaches that are very intentionally integrated in consideration of substance use overlapping with these areas. And then there's a link to the publication website there. Last two, just quick links. You can never go wrong linking to the NCTSN, which is the National Child Traumatic Stress Network, and it has a list of evidence-based practices that link well, obviously coming from a trauma perspective. And if you were here a couple of weeks ago when I was talking about screening and assessment, I referred to this publication from the National Academies, The Promise of Adolescence, because everything that we are talking about needs to go through the lens of understanding adolescents or transition age adults. And this is the best single resource I have seen on that topic. So that was a lot, or it felt like a lot from my perspective in what went over a little bit of 15 minutes. I apologize for that, but that is the end. And the resources and sources section at the end of that can also give you some links if you're thinking about treatment match for adolescents. All right.